Welcome to The Disappearing Mind, a unique podcast helping you find clarity and support along your dementia journey. Now, join National Dementia Trainer and Coach Dawn Platt for an all-new episode.
Welcome to the Disappearing Mind podcast. I'm Dawn Platt, your host, dementia coach, and memory care professional. In this episode of the Disappearing Mind, we're talking about one of the most common and most confusing questions families ask. Is this normal aging, or is something more wrong? We'll also talk about when it's time to stop watching and waiting, and when seeking an evaluation can actually bring clarity, support, and relief rather than fear. If you've ever felt unsure, hesitant, or even afraid to name what you're noticing, this conversation is for you. If you've ever caught yourself saying, maybe this is just normal aging, this episode is also for you. Today, we're going to talk about one of the most common and most emotionally loaded questions I hear as a dementia coach and a memory care expert. Is this normal aging? I hear that over and over again. Or should we be concerned? It is a good question, and a question that really requires clarity. There are several things that are important here that I'm going to get into today, but before I do, recently I had the opportunity to take a little time off and spend some time with a colleague that I worked with for a number of years, who actually also is very passionate about all things memory care and supporting families who are walking this road of dementia. In that time, we really began to reminisce and really talk over some of the people that we've worked with, some of the people that we've helped over time. You ever have those conversations and they really just stir things in you? Well, over the next few episodes, I'm going to be recording some of those things that we talked about, some of those things that really I think are important and we can't talk about enough, because one person may hear it and then by the time you talk about it again, there's another group of people that really are searching for the same answers. That's why I encourage you today to subscribe to the podcast, share the podcast, go through the reference of episodes that we have available so that you can pick out podcasts that maybe are really pertinent to you at this time in your life or the walk that you're on. I want to thank you again for joining me. But as we get back to today's episode, is this normal aging and when to seek evaluation? This is one of the things that is a big question in all of our minds. I mean, I went through this and I know this, but I think it's a perfectly normal question for families to ask. But there's some things that are important that I'm going to cover today in this episode. And one of the things I want to really start out with is when it is time to stop watching, stop waiting, and seek an evaluation. And there are a number of reasons for that. And what makes this tricky is the answer is rarely black and white. You may recognize pieces of your situation in more than one category that we talk about today, and that's not a problem. In fact, it's usually a sign you're asking the right questions. This is one of those episodes that you are going to want to pull up a chair, sit down, have a pencil and paper, and jot some of these things down or re-listen to the episode, because I think it's packed with a lot of good information. So let's get into it. By the time we conclude this episode today, my goal for you is to feel more confident in identifying patterns versus isolated incidents. Understand why the gray zone matters and know when waiting helps and when it hurts. I want you to feel less afraid of what comes next, even if the answer isn't dementia at all. Because here's the truth. Not knowing often causes more damage than knowing. I said, not knowing often causes more damage than knowing. What is normal aging? Let's talk about patterns versus an incident. We all remember the incident or the biggest incident that may have occurred with our loved one. It stands out. But One forgotten word is normal. It is not abnormal to have forgotten words or forget sometimes. Walking into a room and forgetting why, normal, all normal aging, nothing to really be concerned about. Missing an appointment once in a while, also normal. So what isn't normal? And when those moments form a pattern that starts to change how someone functions day to day, this is when we need to be concerned. This is when we move from a single incident or a few incidents to a pattern. I often tell families this: physicians don't diagnose based on a moment. They diagnose based on momentum, things that have occurred multiple times. For example, forgetting to pay a bill once is an incident. Forgetting how to pay bills or insisting they already did when they didn't, that's a pattern. Huge differences here. When you start noticing repetition, defensiveness, or increased reliance on others, that's when the conversation needs to shift. Now let's talk about that gray zone that nobody really talks about. In simple terms, the gray zone is the space between normal aging and clear diagnosis. It's when someone feels off, but there isn't a label yet. You might see changes that are noticeable but inconsistent. More effort needed to do things that used to be easy. Occasional confusion, poor judgment, or overwhelm. Independence that's mostly intact but more fragile. The gray zone matters because people don't need a diagnosis to need support. It's often where early help, planning, and small adjustments can make the biggest difference in someone's life. A helpful way to think about this is normal aging is a bump in the road. Dementia is a detour. The gray zone is realizing the road itself is changing. Most people assume that there are only two options: normal aging or dementia. But most people live in the gray zone for years because dementia is a progressive disease. People can have it for years and not show full symptoms. This might look like increased difficulty in multitasking, slower processing skills, subtle changes in judgment or decision-making, fatigue after mental tasks that used to be easy. And here's why that gray zone matters. Even if it doesn't meet a diagnostic criteria, it can still impact safety, stress, and relationships. Support doesn't start with a diagnosis. It starts with awareness. Let me say that again. Support doesn't start with a diagnosis. It starts with awareness, and we need to be aware, and that's the point that we need to start providing the support and decide whether it's time for an evaluation. Let's get into why waiting for certainty can delay help and whether or not that's a good thing or not. Families have often said to me, "We don't want to overreact." What they usually mean is that we're afraid of what this might confirm. Waiting kind of feels protective for us, but the downside to that, it often delays medication reviews, lifestyle interventions, safety planning, family alignment. Let me be clear here, folks. Seeking clarity is not the same as assuming the worst. It is just getting a better idea and professional help on what's really going on. That's what we're talking about here today. We're talking about that clarity. We're talking about when you need to take those steps and what you do with that. As a healthcare provider, what healthcare providers are actually listening for when you go to your doctor or you're talking to your home health nurse or anyone else that you go to for healthcare, there are certain things that they really are looking for. And these are important for you to know and understand. Doctors aren't just listening for memory complaints. They're not listening that dad forgot this or dad forgot that. They're listening for life disruptions, which is quite different than just forgetfulness. They pay attention to things like changes in independence or new safety risk that you're seeing, personality or behavioral shifts, or how someone explains or avoids explaining their challenges. Which brings us to another question that families often ask me, and that is when to seek evaluation. Evaluation is about support, not just diagnosis. So we're talking about getting a medical evaluation, getting a cognitive evaluation, seeing your doctor, or seeing a neurologist. An evaluation isn't a verdict, it's a starting point. And that's how I want you to see it. Just because you get the diagnosis, it's not a verdict, it's a starting point. And the earlier that you have the diagnosis, whether or not there is one, you can start treatment and your availability to more treatment options is there. Let's talk about what an early starting point can offer you and your loved one. Number one, it can rule things out. Not everything, not even confusion, is always dementia. There are a lot of other factors, and I'll get into those in just a moment, but ruling other things out that could be causing this. It can identify reversal conditions, meaning there could be something else going on, and that needs to be treated, and it would eliminate some of the confusion that you might be seeing. It can open doors to therapy or resources and planning options that people who wait often don't have those same choices because they are too far progressed. It can reduce conflict by shifting the burden off of family members. And importantly, not all cognitive changes are dementia. I want to say that. Not all cognitive changes are dementia. There are several factors and things now. We're going to talk about treatable causes that when treated, and I'm just listing a few. There are many, and I've talked about them before, and we'll talk about them again, but cognitive memory changes can be common, especially as we age. But they can also be caused by secondary conditions, such as medication interactions, vitamin deficiencies, nutrition deficiencies, sleep disorders, depression or anxiety, thyroid issues, a tumor, multiple types of infections that with it cause confusion. I've seen people significantly improve once the right issue was identified and treated. And that's why it's so important that evaluation matters. You may not be looking at dementia at all, and that would be a great relief for you. But unless you explore that, you will not know. As we age, seniors are more prone to things like urinary tract infections, things like respiratory infections, which contribute to our cognitive health as well. Those are things that I want you to be aware of and not always fear or wait and delay that evaluation because you're fearful it might be dementia. There's a huge cost to waiting. I want to talk about that. I want to be really clear because I want you to be aware of what those could be as you're making your own decisions. These are your decisions to make, but I want you to be aware. Waiting can cost time to intervene. There are different stages of dementia. There are different stages in an infection. And the longer we wait to intervene or get an evaluation or a doctor's opinion, the worse things can get. Safety is a concern, especially in an elderly person. Safety is really important because many times they're fragile, and we want to be sure that we're seeking early intervention. Emotional energy, not knowing for you or for the person who is experiencing this, it really can be costly to go through this and not have professional guidance from your physician or another healthcare provider. And then trust within families. I want to talk about that just a minute. A lot of people who live remotely or even, I guess, local, there'll be differences in opinions between family members of whether or not mom or dad is experiencing something that needs intervention. Don't let that delay you in finding out whether or not there's really something going on, because that can be costly. And in a frail elderly person, it actually could lead to death. I mean, there are things that happen with people as we age that can be complex. So it's really important that you not wait to seek treatment, at least an ER visit if you don't have an immediate physician visit. Often one person is quietly carrying all the concerns while everybody else says it's probably fine. And that can be an awkward place to be, but I just encourage you to seek and find out, get that exam, and have clarity in what you're doing. You're not alone, and you do have decisions to make. They're yours to make. I'm just here to help guide you, and I hope this podcast guides you today. That's a heavy burden when you are carrying kind of the weight and you don't really know what to do. Listen, we're not born with the ability to always know what to do. So seek your physician out, seek the healthcare professional. This burden is not meant to be carried alone, and we here at the podcast just encourage you to seek out for help and evaluation. Who should push for the evaluation? I think that that's also a delicate subject that I want to hit on today in the podcast because it could be met with differing response. Spouses, I will say, over the years of working with families, spouses often minimize or hide or cover for their loved one. They live together, especially if they live together for years. They depend on one another, and they may minimize what's really happening as they age together. Adult children often overcompensate for their loved one as well, but providers, meaning your doctor, neurologist, they listen best when concerns are framed around function, not fear. I spoke to you earlier. Write some of these things down. Keep a journal. Keep factual information with dates and times and incidents if you are concerned and starting to see a pattern versus a single incident. Instead of saying, I think mom has dementia, try saying we're noticing changes in how she manages daily tasks and we're concerned about safety. Those are things that are solid and things that your doctor can really understand and address. That language is going to matter when you're reaching out to your doctor. I've coached many families on what they need to say based on the information that they give me, and it really does matter to get your physician's attention. Let me say that these red flags that we're talking about here aren't always memory-based. They're not always forgetfulness. There's more at stake than just that, and I want to go over some of those things. Some of the most important warning signs have nothing to do with forgetting names. More poor judgment. So judgment is something you really want to look at. If there's increased impulsivity, that's a real sign, and it is concerning. Oftentimes with certain types of dementia, they become more impulsive, and this can be a safety concern. It can involve a lot of concerns in and around the individual. The loss of insight, that's very important. Personality changes, which we often see in some types of dementia, these are real factual things that could be impacting something going on in the brain. And then difficulty following familiar routines. These are signs that something's changing. Could be normal aging, but it could be something else. Memory is just one piece of the puzzle. Families will often say to me, well, mom doesn't have that. And I think there are common terms and common thoughts that we have around Alzheimer's disease in itself, but not all dementias have the same symptoms, progress the same, or have the same course of staging as Alzheimer's disease. So these are other factors I just want you to be aware of, not fearful of, but things that will educate you and help you make good decisions. Let's talk a little bit about the fear of knowing. I think many of us can relate to this. And I don't know a family that doesn't go through some kind of fear. Obviously, some more than others, but let's talk about that fear because it's real. It's real to you. It's real to I. Okay. So there are fears, and you probably fall in one of these three categories, maybe multiple, but what this means long-term is a major fear that I hear from families and I have for years. What this means long-term, we're always concerned about that, and it can be a real fear that you might be facing. Of course, loss of independence. The person themselves is going to fear that, but so are we children and spouses. That loss of independence, that's really important to who we are and how we live. And then changing family roles. That's a real fear. I have dealt with many spouses and adult children who go through this because we don't always know what to do. We don't always know how to balance our own family, our own roles, and now our parent needs our help and support. And I'm going to say for that, you may need to seek out counseling on that. It is different. It is a change, and it changes the roles around you. It changes how you interact with your own spouse and children and your job and your role. It's not easy. And so I always encourage support groups if you have one near you, one that fits your needs. And I also encourage people to consider professional therapy to talk about navigating that road. It's a real road, and it changes and it winds, and there's a lot. So these are the major fears that most people, most families historically are going to fall into one or more of these categories. Here's what I tell families. Knowing doesn't create the problem. It gives you options. It gives you options. Knowing takes away uncertainty. Uncertainty keeps you stuck. Information gives you movement. This is really important, and I hope that you hear me when I'm saying this, that not to get stuck in the fear realm. Knowing gives you opportunity, gives you options. Then you can move on to what the options are for today, next week, next year. These are things I think are really important when we talk about aging, when we talk about evaluation and how to go about it. When the answer is normal aging, mild cognitive change, or something reversible, or even a form of dementia, that brings clarity. Where are you falling? The outcomes provide you benefits and reassurance because then you will know what you're dealing with. Normal aging, mild cognitive change, something reversible, or a form of dementia. It really puts you in a different place with different options. There's huge value in clarity. It allows for planning instead of reacting. It supports instead of providing conflict. It provides safety instead of crisis because most people, I'll say this, most people often have a crisis situation that really is the kicker in seeking out help and evaluation with diagnosis. It is some sort of crisis. Someone getting lost, an accident, an incident that is just like cannot go unnoticed. And you don't want to get there. That's not the way that you want to handle this, if at all possible. And clarity provides you compassion instead of frustration because now you can move into a realm where there's thousands of people that have walked this walk and can provide you guidance. They can share their experiences so that when you're care planning, you can make solid decisions. I want you to do a number of things before I close today. Write this down because I think it's going to be important. I want you to start observing patterns. Look for patterns, not incidents. Incidents will stick out in your mind, especially when they first happen and they get all blown out of proportion. But if it is dementia, they're going to turn into patterns, and there are going to be more things that you're noticing if you look. Start observing for patterns and write them down. Keep a list so that when you do go to the doctor, you can take it with you and it will be fresh in your mind. Talk with someone you trust. Hopefully that's a healthcare professional. And don't wait for certainty before asking for help. These are things that are the call to action for you if you are finding yourself in this situation. If you found this helpful, I want you to share it with someone who's quietly wondering the same thing or going through it. It's not a great place to be, and I think that this will help them. If you want more practical guidance on navigating cognitive changes with clarity and compassion, I want you to follow The Disappearing Mind wherever you listen to podcasts. Share, subscribe. We do have a list of resources available to you on the disappearingmind.com website that you will find very, very helpful. You don't have to have all the answers. You just have to take the right next step, and we will guide you in that through our resources. As we close today, I want you to remember this. Questioning what you're seeing does not mean you're overreacting. It means you're paying attention. Cognitive changes are complex, and they don't fit neatly into categories every time. You may be in the gray zone, and you may be facing something temporary, or you may be at the very beginning of a longer journey. All of those realities deserve understanding and support. You don't need certainty to take action today, and you don't need a diagnosis to ask for help. What matters most is noticing patterns, trusting your instincts, and giving yourself permission to seek clarity. Knowledge does not take away hope, it creates it. Thank you for spending time with me on the Disappearing Mind podcast today. I hope that this episode is helpful to you and in what you're experiencing. Again, I encourage you to share it. I encourage you to review the list of episodes that we have for a podcast that may be specific to something you're looking for. And remember, you're not in this alone. There is help, there are options, and a path forward. One thoughtful step at a time. Until next time, this is Dawn Platt. Make it a memorable day.
Thank you for joining us for the Disappearing Mind podcast. We hope it's helped you find clarity and support along your journey. Be sure to subscribe to never miss an episode, visit our website to suggest future topics, and share the podcast with friends and family.